Okay, let's talk about your physician, Dr. Vinay, and how important he is to your hair restoration process. Probably as a joke, the most important thing here is the Northwestern hair restoration team, not just the clinical team, but the people who are involved with your care overall, how they keep things smooth and actually really contribute to the results because obviously just making sure you get in for your aftercare appointments and everything does make a difference. But I will tell you here at Northwestern Hair, we always the same team. We don't have anyone that travels in or flies in. Everybody is local. Has worked with us essentially since the beginning. And if any one of them retired, then pretty much the team has decided they'd be retiring too. So I will tell you this, I take full responsibility for all your results. I'm involved with everything from your consultation to planning your procedure, which is by far the number one thing we're going to be doing, to orchestrating your procedure day, performing most of it, and then afterwards your aftercare, making sure that these hairs grow, and then ultimately kind of guaranteeing results. Let's say we have an issue that pops up, a small little area that hair doesn't grow. Nice thing is I own this company. I can decide that we're just going to take care of it. And there's really never been an instance where a patient hasn't been happy at the end of the day when something doesn't go perfect. I can count on my hands who those people are, and I'm glad they're still with us. Who am I? I'm Vinay Rolani. I trained at Northwestern for both medicine and plastic surgery. I then went on to specialize in hair right when I got into practice. I've been doing this since then. 95% of my practice is hair loss, about 5% is weight loss, but I lost 42 pounds myself, and I do help other people doing that. But my main focus is this, and I do it the vast majority of my day. What parts am I going to be playing? Well, I saw you for consultation. That's where I start. I do not let anyone make any decisions about your care. I make them all. And you do not get to surgery with a plan that essentially I don't think is going to result in a good outcome because I'm responsible for it. I will plan your surgery. I will do the timeless hairline design or timeless hair design. That is the most important thing we're going to be doing on procedure day, including the procedure itself. This is where we map out your final hair loss pattern. We build upon that foundation to create a foundation of new hairs that's going to look good into the future, such that when someone sees you from all angles, it looks good. And then we're going to do our kind of fancy artwork to make sure that the present crosses the past in a good, nice, evolving way. I will be doing that. During the procedure itself, we have 4 steps we need to do. And we have sometimes thousands of hairs. Let's say we have 3,000 hairs and there's 4 steps each. That's 12,000 steps. I need 2 set of hands to help me out. And we have Lyda Oland and Delia Battaglia, people who've been working with me forever, who I trust. They both have 25 years plus experience. And I'll tell you, Lyda has probably trained everyone in the city. They both started at Bosley together about 25 years ago. So in the morning, I will be taking all your medications. Medication is the only thing in this procedure that can actually hurt you. And I make sure I do all of that. And then when we're getting to extractions, there's 2 parts to extractions. There's actually taking the hairs out, and there's evaluating the hairs and then making adjustments based upon the way those hairs look. Now, I will start the extractions off. I will get our settings about 80% there. Then I will go underneath the microscope. I'll be looking at these hairs and making some adjustments. If you're getting micro, man, we can make adjustments every single hair. If you're getting a standard FUE, the only thing we adjust is speed and size of the bit, whereas micro, we can switch from vibration, oscillation, to shaking, to mamba, to suction. We can do it every 50 milliseconds. So with one hair, we can make essentially 4 changes to get that hair out in a nice custom way. So that evaluation process is really important because it feeds back on how we take out the hairs. So Lyda, Dee, and myself are all involved in this part of the process. After we're done there, we will know up the top, the scalp again. That's a medication. It'll be my part. And we'll start designing how we're going to stagger these hairs based upon the lines we created in the morning or the night previously as part of your hairline design. I will be making all those critical incisions for where your hairs are going to get placed. And then, bless their hearts, Lyda and Dee are going to take over for us today, and they're going to be placing these hairs. I just do not have the patience or the hands that they do after 25 years of placing these grafts, staying very delicate. I created something called a no-touch technique, specifically because I don't want these hairs being damaged. And I can tell you that you want them inserting these hairs and not myself. At that point, I'll make sure that your aftercare is all set up. And when procedure day is done, you're 100% back with me. All your aftercare visits are with me. I'll be looking at the grafts, make sure things are good. If you're doing micro or doing ACS procedures afterwards, it'll also be on me. And ultimately, your results will all be on me. But the day of, we just need help from 2 very special individuals who I would not do this without.